Welcome to the Active Birth module. This module will offer an insight into the benefits of and practical approaches to supporting upright active birth positions to improve outcomes and women's experiences. The aim of this module is to improve birth experiences for childbearing women and their families. By completing this module, you will increase your knowledge of birth positions, appreciate ways to support active birth, explore the benefits of active birth positions, and review ways of overcoming the barrier to optimal birth positions. This module is good to complete alongside the birth physiology and birth environment modules. It is important that women are supported to feel comfortable and feel in control during labor and birth. Frequently, women find themselves lying down on bed or adopting supine positions during their labor and birth, which are known to be suboptimal, especially when birthing in health facilities. It is crucial that midwives and birth workers increase their knowledge and skills to inform and support women to adopt a range of positions to optimize labor and birth experiences. Upright and active birth is about supporting women to move freely through their labor and birth, adopting positions that are comfortable for them and where possible avoiding prolonged period of lying on a bed, unless preferred by the birthing women. The movement of the fetus through the pelvic during labor and birth is supported by uterine activity, coordinated by a complex interplay of hormones. Effective application of a well-fitting presenting part helps to coordinate effective, regular uterine contractions. Upright positions enable to optimal fetal positioning. Take a look of our birth physiology video for more information. It is useful to remember that all pelvises are different and each fetus will adopt varying positions in response to their environment, and the woman too will adopt positions in response to others, including the way her fetus is lying. It is useful to think of the pelvic as having three varying spaces that the fetus must pass through: oval brim, entrance, circular cavity, and diamond outlet. As such, as the baby enters the pelvic in transverse, most commonly, rotating into the cavity, either anterior or posterior, then being born through the anterior-posterior diameter. Adopting upright positions and remaining mobile during labor and birth can aid this process. Which are the benefits for women and babies? Remaining upright position during birth has shown benefits for childbearing women and their experiences of birth. There is evidence that demonstrates that walking an upright position in the first stage of labor reduces the duration of labor, the risks of caesarean birth, the need of epidural, and thus not seems to be associated with increased interventions or negative effects on mothers' and babies' well-being. This review includes 25 studies involving 5,218 women. Although many studies were not of high quality and most of women were low risk, there were some important the findings have meaning for women as they directly impact on their experience of birth. Further studies are needed to confirm the findings in all women and to enhance the quality of the evidence designed. However, based on the result of this review, we recommend that whenever possible, Women should be encouraged and supported to use upright and mobile position of their choice during first stage of labor, as this may enhance the progress of their labor and may lead to better outcomes for themselves and their babies. The World Health Organization reviewed this evidence when compiling the recent guidelines for labor and birth support. Midwives and birth workers are encouraged to support upright position and active birth for women during labor and birth, choosing the positions that the woman feels more confident. Review your local guidelines against evidence and local context. Support staff training and information. Run local active birth workshops and include a focus on birth physiology in annual updates. Review the birthing environment involving service users and staff. Source supporting equipment to help women move and adopt a range of upright and comfortable positions. Communicate any changes or updates carefully. Reinforce the woman's trust in her body and baby to birth. She can try a variety of techniques to encourage the baby to move through the pelvis. If the baby doesn't respond, it's because the fetus has chosen their optimal position for labor. Thoughts from Dr. Rachel Reed's Midwife Thinking blog. Penny Simpkins' work, Active Birth, Spinning Babies, Jean Sutton, Optimal Fetal Positioning. Share positive birth histories and connect her with other women who have experienced positive labors and birth. For example, Positive Birth Movement, Tell Me a Good Birth History. During labor and birth. Trust the labor and birth journey, responding to what is happening rather than what you think ought to be happening. Supporting and recommending when needing. Offer a supportive environment where the woman and her birth partners can instinctively move and respond to labor and birth. If the woman requests help or would you prefer to do something, there is a number of techniques that you can use to help. Upright position and active birth could be used most of the time during labor and birth and practiced in a variety settings as a home birth, MLBU, or obstetric units. In summary, upright active birth positions improve birth experience for childbearing women and their families.